Should be easy enough to read, I think.
Can I read it? 310-6055.
Correct.
Here's Joel. And they'll keep mentioning Joel. There he is. That
Weird.
beard.
Hi,
Huh?
Dr. Clearfield.
Hey there. How are you?
Good. How are you doing?
Been a while, hasn't it?
Yes. I'm looking forward to hearing Dr. Burgess, though.
Okay. Yeah, he's got quite the outlook on everything. So
Yes.
you're going to come to our conference in December, correct?
Not sure I'm going to make it this time,
It's
but
online.
but it looks great.
It's online
Yeah.
and 20 credits, and it's online. You can join us that way. Where are you
Okay.
again?
I'm in Dallas.
Okay. So yeah, like I said, you can join us online. We'd love to have you, and
Thank you.
and Joel will be there. He's our beard of knowledge here.
That's right.
Yeah, you're coming home finally, huh?
That's right. November 23rd,
All right.
just before the holiday.
Oh, 23rd.
Here's my
Yeah.
Yeah.
Let me see. Let me look on the calendar.
When he came in here, he had no hair. None. Zero.
I know, right?
I have a student with me.
Nice.
Yeah, he's from Kansas College of Osteopathic Medicine.
Wow.
So he's been here 2 days. Your name comes up quite frequently, from that are here, as you know.
Amen. That's good. That's good to hear.
So it's good to put a face to the name.
Mm-hmm.
Agree. There's Kent.
Hi, guys.
Hey, Dr. Crowley.
Dr. Crowley, we're going to see you online, right? In December.
Yes,
Must-
you will.
Were you turning into Dr. Quinn with no shirt on?
I think I finally fully tore my right shoulder. It needs a total reverse replacement, and I have just destroyed it today.
Mm.
That's not good.
No,
Oh, God.
There's another guy with-
I see my naked friends. Is anybody hearing me?
Yeah, we hear you.
Man.
Yeah.
Good to hear you.
Likewise, man.
Oh, yeah.
There's Bill.
Oh, like the
Yeah.
Hi, Bill.
So how you doing, John? You ready for this?
I was all anxious to see if this shit works. What I have, I put all my stuff to make it convenient and fast and easy in a QuickTime movie, and I can watch it here. Does that mean it shows up on this meeting?
Movies don't translate too well. I mean, little short ones might. I mean, you can try it, but they don't.
Okay.
They don't really translate all that well.
All right. Well, how do I get the screen so we can try it?
You have to see at the bottom there, it says there's a green button that says share.
Yeah,
Okay, hit that.
I did that. And it says mute website notifications while sharing. Then it has a not now, and then it has an allow. God damn, man.
So it's not going to allow you to share your screen?
no, click the allow.
Okay. It's not highlighted. The allow is not highlighted. Not now is highlighted, but allow is not. Oh, man. That's what I was afraid something stupid would happen.
It may be in your settings.
You'll get it.
Oh, man.
I'm not.
All right. Bill has an emergency backup for me if I can't do it.
All right, so
I
let
can
me,
also do Kino from here, but I
let
got
me-
the whole thing in films, nice movies and stuff.
all right, let me go.
And it's in VLC if you've ever dealt with that.
I should have known. He does this every time.
All right, I can do a straight shot. I was just trying to ease the pain of talking about Nazis and torture, so I did movies of beautiful angels who came to save Bill Clearfield. My first slide says, "This is the angel floating from heaven." She says, "Oh, doctor, what happened?" While she's looking at you, Bill, and and the rest of us, I think. So anyway, so we'll cut the comedy and go straight to the mind control and pain, but we have answers for the pain, so that's okay too.
Great.
Share screen. Click on share screen. And it says not now. Never mind. I'll send you some movies. How's that?
What program are you using? Is it on this?
My video is VLC. My internet is FireWire. And man, it says allow Apple Zoom US to see your screen.
What was that?
And well, it's Tuesday integrated webinar. Oh my God. Oh my God.
You got it?
Well, I clicked something and your face got real clear. Yeah, man, it can do whatever it wants. Anyway,
when did you send me your do you remember what day you sent me the
that was about a week ago, I think. I sent you the necessities. And if I can get this movie going, we're really running cool and fast and quick and easy. Anyway, if I only knew how to do it. Now I got security and privacy.
All right, I got it in case you need it.
Nice.
I have
Okay.
in case you need it,
All
I
right.
have it.
All right. So I guess there's no way for me showing my movie to you guys, huh?
Probably a separate click button because it's video, not screen, right?
Is there something I should do? Because I'm the host.
Oh, I don't know. Let's you give me. How do I make? I hit share screen here, and you get nothing. I don't think.
Yeah, I mean you should. We have it so everybody can share the screen, so you should be able to get that.
All right, we'll go into emergency plan. It's
If you
8
can,
o'clock.
I have your slides up, so I can put them up, and you just tell me when to move. That's all, if need
All
be.
right.
Okay.
Okay, there you go.
Is Dr. Nario on yet? No.
It's a good thing we had backup for backup for backup for backup. Now we're getting it done.
Yeah.
Hoorah.
Are we going to wait for the leak of the week with wonderful Dr.
Yeah, Dr. Nario's not on yet, so
Yeah.
actually I haven't heard from him in a few days. He may be away, so
Well, I was hoping everybody would laugh when I had the angel descend from heaven to save Bill and ask him the question, "Oh, doctor, what happened?" And that's what this lecture is about. This is what happened over the last 50 years.
isn't that my topic?
I got 47 years. You got 50. I think we've both been kicking ass for about.
I started medical school in 1975, so that's 50 years, right? Holy cow.
Okay.
I think I'd know what I want to be when I grew up.
I was in a hospital having surgery from torture in 1974, actually. So, and then it went straight into how in the hell you get rid of this pain. And it took me 10 years to find the neural therapist who really did wonders. And that's why we're here.
So I asked AI how to do it. It says, I asked AI to do it. It says to share a VLC video on Zoom, open the video in VLC, then click share screen, which you did in Zoom. Make sure to check the share computer sound option and select the VLC window before clicking share. Does that make any sense?
No, but you impressed me, Jenna.
Did I know how to use AI?
A little. Oh, yeah. That's how we made all these films. It's wonderful. For me, it's wonderful. But I know absolutely we are cutting new territory with AI. it is able to read your mind and do things you would never expect. So that's why it's a little strange for me. But anyway, AI is wonderful with the images and movies you can do. We can do all kinds of first class stuff now without even trying too hard. Anyway, what you said to do, I tried and I couldn't
Right,
get
you
to.
can write a whole book in an hour and a half. Just ask Dr. Halassa.
Yeah, who else we have on here?
Dr. Nario showed up finally.
Well, is Dr. Tano on this list?
I didn't see him.
Not yet.
Because he's our main publisher, and yeah, he can knock one out real quick. But the AI blows my mind, folks. I feel like an old granddaddy in a new world.
The problem was I wrote a like 125 page sort of mini book on the hormones and pain control or psychiatric diseases, and he took it and put it into his AI thing, and it didn't sound like me at all. And it came up with its own treatment protocols, nothing that I would do.
Yeah, I'm afraid that a lot of people who make big discoveries that have not been released yet may not ever be released, because once they are filtered through AI, if it's not known information, it will not pick it up. So some of us, old timers who are talking about stuff that's never been talked about before, if it gets filtered through well, that's why you guys did the show on AI bias, right?
Right. The question were we for the bias or against it?
Oh, God. I can see you have misinformation. I've gone back for information I was able to get last year and 2 years ago, and it's been erased from the internet.
Would you wait just 2 minutes? We're gonna
Anyway, but
Dr. Nario, you're here for our tip of the week. Just listen to this.
Yes. I'm ready. You want to start it?
Do we need to introduce you? Doesn't everybody know?
I think everybody's so tired of me. You don't have to introduce.
I keep telling him every week that we don't have to go take this class. We're just learning it through you.
Yeah.
By the way, I have spent days and days coming up with AI films related to the leak of the week.
Oh, nice.
And we got to get back to the leak of the week, or we're going to waste my AI films we came up with, right?
I don't want to waste them, so
we don't want to waste that.
Just send us a whole list of topics, John, and we'll take it from there.
All right.
Okay.
All right, Dr. Nario, go for it.
All right, so John was talking about this. So the leak of the week was actually our leak of the week this week is a requested one by our viewers, and John included. And I'm noticing that more and more of you are sending in your own topic requests. So keep them coming. I love seeing the engagement, and I'm grateful when people say that they're learning a lot from our segment. So let's hear your ideas. Let's keep the dialogue going, and let's keep exploring integrative concepts through the lens of the Andrew Weil Fellowship together. So when we talk about GMOs in the US, we're talking about a handful of crops that have quietly taken over the entire food system. And the main reason why they exist is it's not nutrition or health, it's convenience for large-scale farming and chemical companies. So let's go through the big ones. So we already know soybeans, right? Almost all soy is GMO, mostly survived being sprayed with herbicides. And because soy ends up in everything from protein bars to crackers to restaurant oils, you're basically eating soy unless you live off the land. The concern here isn't the genetics, it's the herbicide load riding along with it. Another common one that we're in the know of is field corn. GMO corn shows up in corn syrup, cornstarch, corn oil. It's in sodas, bread, sauces, snacks. If it has a barcode, it probably has GMO corn. And again, the issue is the chemical system, herbicide tolerance.
Yeah.
Did you lose him?
That's our internet. Oh no, we lost him. Usually it's my internet that goes out. So that was him. Yeah, he's gone.
For now, he'll be back.
He'll be back.
Yeah.
So, okay. Well, in the interim, while we're here, let us talk about the Congress of Medical Excellence 5.0.
Yeah.
those of you who don't know, it's coming up December 4th to 6th in Reno. We have 3 days. Day 1 is our integrative medicine research day. Day 2 is homeopathy, and day 3 is our integrative medicine sort of principles and practices. We have, as you can see, the speakers here. You can see me here at a very younger age. Dr. Mario, Dr. Gerber, Dr. Devlin. Here are our, sort of superstars. So Dr. Swadan, if you don't know her, she's like the number 2 speaker at A4M. We'll pay a lot of money to go hear her. Dr. Gersh is all over social media. She's our integrative OBGYN. Dr. Schallenberger is sort of the father of ozone therapy, and Dr. Thomas Levy of homeopathy and vitamin C fame. He's coming from Medellin, Colombia, to be with us. So those of you that are in Arkansas can make it, if he can make it all the way from Medellin, Colombia, and we're not paying him. So Dr. Dimitri is Air Force surgeon, and he's head of the National Foundation of Integrative Medicine. He's going to talk about heavy metal toxicity. Dr. Siegel is our getaway speaker. And, she's a veterinarian. And those of you are most of us are medical person doctors and whatnot. She's been on our podcast here a couple of times. She is just absolutely fascinating. And she gets to do a lot of the things we'd all like to do without a lot of the restrictions we have to put up with. Dr. Ullman is a prominent classical homeopath. Bill Andrews is a local here in Reno. He's an inventor. He's put together many different products. He's 50 patents, mostly in cancer research. Dr. Tano, we don't need to really talk much about him. He's probably the smartest person in our room. He's an economist. He's a physician. He's a publisher. I haven't spoken to him about any topic that he can't run rings around me and pretty much everybody else. Dr. Burgess, our speaker tonight, has been my right-hand man for many years. Dr. James is from the Tribal Medicine Network, and he talks about the bias in AI. Aaron Wolf is a local homeopath, and he's also a classical homeopath. So these are our main speakers. We got Dr. Homafarb, who's a dentist, an integrative dentist, also coming. So we have a really good lineup. The agenda, as you know, is Thursday, December 4th, and it goes through December 6th. We have a number of sponsors that are going to be with us. We have all of the lunches covered. So Thursday is Solution Specialty from Las Vegas. They're all going to be giving us about a half-hour non-CME talk. Sierra Pharmacy, the local here in Reno, will be Friday, and Dawn Gowery will be here from College Pharmacy in Colorado Springs on Saturday. We're working on, I think David Kahn is going to be here. Those of you who've been with us for a long time know David. He does the PMF therapies, and he's got the what's the stuff what is that? It's a fermented ginseng. He has also. And we're working on a number of others. The venue is the Element Hotel. It's in right in the it's not downtown Reno, but it's in the sort of the revitalized area. It's a brand new hotel. It's not big, it's small. It is a Marriott though. We have a good rate for you, $179 a night, and for 3 nights. And those of you who are not familiar with Reno, if you like skiing, Lake Tahoe's not 45 minutes away. We're number 2 as far as cities in Nevada. If you like casinos, the Pepper Mill's across the street. It's a pretty nice venue. Friday night, we're having a sit-down dinner, and we're having Tea and Keys, and Dr. Fong will be entertaining. And we'll have some other surprises also. It's not that expensive. The amount, the cost. I mean, we're spending almost. Those of you that are online, well, if you weren't online, to those of you that are attending, if you're not a physician, we're spending almost as much money on sort of entertaining and for each person as you're paying, and that's not counting the CME credits. If you're a homeopath or a homeopathic physician, homeopathic assistant, or advanced homeopathic practitioner, we're accredited by your boards for 20 CME credits for you, which is what will get you continue your license. And it's been a long time since we've all been together. It's been almost 3 years since we put the band back together. So please attend. These things have gotten a lot more expensive than the last time I put one of these on, and we were at in a strip hotel in Vegas, and this is costing almost as much, and this is just a tiny hotel, and so we put a lot of effort into it. We really need your support, and please take our website here, our link, copy it, send it to all of your colleagues, send it to your patients, send it to your email contacts. We're getting pretty nice return. We have people coming from Louisiana. We have people coming from New Jersey. We have people coming from Canada, and so Minnesota, Long Island. So the word is out, but we need more bodies in the seats. So I think Dr. Nario, are you back?
Yeah, I got my internet's going crazy.
All right. So usually it's me. So go ahead.
Now I got it too.
I know Dr. Burgess is sort of chomping at the bit here to get going. So
okay. Yeah, let me just I guess
I like the way Melvin shares information. It's right at my brain's speed. The words make sense and everything else, so it's always enjoyable. Take it away, Dr. Nario.
All right, so where I got cut off is, I guess I want to differentiate sugar beets. So about 95% of them are GMO, and most of the granulated sugar in processed foods comes from them. So if the label just says sugar, it's usually GMO beet sugar unless it specifically says cane. And this crop is another herbicide tolerant system.
Yeah, there he goes again. I saw it happening there. I don't know if you saw his lips were moving, and the talk wasn't the same. So, like I said, it's usually me. So, all right. Are you? If he gets back, fine. If not, we'll let John get started here.
Yeah, so I'll just do it here on the phone. So I have my
okay.
Back up.
Going back. So just saying that when you talk about sugar beets, is something that was different from beetroot nitric oxide supplements that we talk about. And this is something that, again, is a common mistake that we're thinking that they're also GMO, but they're not. Because sugar beets are grown both. So they're GMO, they're sprayed, they're down until nothing beet-like is left sucrose. So beetroot supplements come from red beet varieties. And these are non-GMO grown for nutrient density and actual retain nitrates, antioxidants, betalains, and even.
Okay. He's gone for good now, huh?
I hope that weird audio was him and not me.
Yeah, I think it's him. Okay. I hear you fine.
All right.
All right. Do you think you can get your slides up?
I'm not even going to try. I'm just going to say next with you in control.
All right. So you want me to get them up? I'll get your slides up here for you.
Yeah, but I'm doing the screen share. Yep, it's just in order sequence. We'll just do 1 through whatever it is, 100.
This is not the right one, right? This is the one.
No, that's not the right one. That's the right. That's it.
Okay, there we go.
You have like 100 slides. Let me make sure we're doing the right thing.
It says 152.
Okay, we'll cut it short. We'll be fast.
All right.
You ready?
Can everybody see it?
No, it's only taking up the bottom quarter of the screen.
Let me see. But you can see this. You can see the slides, right?
I can see the slide, and it's reduced by about half.
What else?
It's probably part of the
You have
grid.
to start slideshow.
That's all right. We got it. If you just want to, if we just go, I don't think I have
How
any.
about that? How's that?
There you go.
It's good enough.
Okay.
Do I have any control or am I just, oh, nice. Look at that, man. Wait till you guys see the movies. It's incredible what AI can do. It's mind blowing. But this is good enough for us to get everything done. Do I have any control? You got it all, Bill.
I think I have it all. So
Okay. We're going to talk tonight about neural therapy. Most people are becoming more acquainted with it now. I was introduced to it in 1984, 85, 6, 7, 8, 9. Then they won the Nobel Prize in 1990. I thought at that time most American doctors would hear about it, especially since it got the Nobel Prize with what's called the patch clamp technique, how you measure intramolecular variances, and that can be products. And in this case, the big discovery was, guess what it was that was healing everybody with injections of lidocaine, including systemic diseases? It was voltage increase. The lidocaine stabilizes cell membrane and the voltage increased within the cell. Therefore, the cellular communication was enhanced. Ta-da! Same old thing they discovered. And they discovered this in like 1920. And in the 30s, they did major research. And then a war took over and we all went to steroids and narcotics. But the Germans were the ones who discovered all of this, but 100 years ago. And the answer is voltage. So all you guys who are dealing with those crazy new things like Tesla, energetic things, that type of stuff, that's what it's about. But all of this took place 100 years ago. And we're just hearing about it now because it was never translated into English until 1984. That was the first English version. And that's why it took so long for us to learn it. But it's real simple. Lidocaine increases voltage. It enhances the cellular communication at a segment because neural therapy is segmental therapy. It's an automated regulatory therapy. And we'll go into that because they just got the book out on segmental therapy a year or two ago. Next.
it's the books. Is that what we're showing?
Next slide. Oh, yeah. Look, you wouldn't have to hear me at all. If you just get a couple of these books, and Bill, flip through the next books. There you go. Get the Atlas of Neural Therapy, the books. They'll show you how to stick, where to stick, and we'll review some of it. But it costs about $100 to get some incredibly fine books. And they title their books according to Hanukkah, right? You do it your own way. Use your brain. That's what they want you to do. Here's the new book on segmental therapy. Hold on right there, Bill. You'll notice it says the key to mastering acupuncture, neural therapy, and manual therapy. For people like myself, I went through the acupuncture, neural therapy, manual therapy, and all of those, according to the Germans, are just proper regulation of autonomic segmental therapy. Next. And by the way, this new book on segmental therapy, it's a mind blower. If you're a geek, it's got enough to keep you occupied for a while. Next.
Very cute.
Man, did I blow it? I thought we made it.
Like the years.
Wait a second. You had 150 slides. There you go. So here's what blew my mind in next. There you go.
What am I supposed to be on, John?
Right there. No, not that, back. One back. What is it going on here?
I have neural therapy to treatment of disease by local anesthetics. That's what I see.
Oh, yeah. That's what you see. We got a cute little picture of me from 100 years ago.
That was this one.
You got it, Bill. There you go. Anyway, we'll, there you go. Hold it right there. So I read an ad in the American Medical Association Journal of, or JAMA, right? In the back of a book. It was about 3 lines, and it said the treatment of systemic diseases, not pain, didn't even use the word pain. The treatment of systemic diseases with local anesthetics. So we use local anesthetics to cure liver disease, heart disease, lung disease. And my impression, and this was being put on in Canada by Germany, which is all part of a big European federation. And I figured it was shit or shinola that these guys really had discovered something if they could do what they were claiming. Or, just people trying to make some money off some cheap drug. Anyway, that's how I went to Canada for a few years to learn what the latest and greatest was. And the way they operated was, please bring us your most complicated, difficult, hardest to treat patients. You got the bad boys who have been crushed, that type of stuff. Bring them with you. And we will treat them in the 3 days you are there. And in the many, many cases they treated, which were completely unsuccessful in the United States, they had 100% success within 3 days. So that virtually all of the pain was gone and they were back to normal within 3 days. All through showing us that regulation, normalization of the autonomic nervous system, and you do that through voltage. And if that's how you do it. They made us look like Boy Scouts. I dealt with the guys who are supposed to be the best with needles in the U.S. and they blew my mind. When I say they made us look like Boy Scouts, there was nobody in the United States doing the depth, the penetration, and the dangers that come with it. And that's what they were doing. So anyway, I got involved with it. Next, I'm an osteopath. That's all that says. Man, these videos are delayed all to hell.
Yeah, there seems to be about a 7-second delay for some reason.
Okay.
So
I'm sorry. I'm sorry.
Because it's all opinion.
You there? You're okay. It's all opinion comes from Dr. Ward. Remember him from Michigan?
Yep.
Yeah. And he was our #1 doctor our first day of medical school, and he said it's all opinion. And boy, those are the biggest, most beautiful words I think I ever heard. Listen to everybody. They got opinions and have their reasons for the opinion. Next. And but we have to share. We have to listen to those opinions. And if you do, there's a lot of learning out there. And there are big discoveries now that are coming through. And in 1 month in Reno, what's going to be happening with this group in Reno is pretty profound. Some of the announcements have never been announced before. And as Bill said, Dr. Tano, our brainchild, will be presenting a new book he published on our discoveries in what's called homeopuncture. So I'll do a little bit of that tonight because it just makes sense. Combine acupuncture with homeopathy, whatever million ways you have to do it. Anyway, if you do this, normalize it, you get reduction of pain and reduction of systemic disease. And this automated system is responsible for both. If you have an interference, a blockage, surgical scarring, trauma to tissue, it will block an acupuncture meridian and it will block recovery. So you can go 20, 30, 50 years and it won't recover if you can't get through the scar tissue. If you inject the scar tissue, it's through in a couple of minutes, couple of seconds. Next. But the point is, if it treats pain and systemic disease, we're dealing with the autonomic nervous system. Man, we're on a delay. The slides are problematic. Is the sound skipping, or can we all hear?
No, we hear fine.
Okay. Then everything I had to say tonight is relatively simple. I just want to point to the Germans and say that they were the ones that discovered it, advanced it, my God, and then shared it. And when you joined their medical community, pain's an alert system. Systemic disease is when the organs go. So you get a warning, you're screwed up. That's pain. And if you don't take care of the pain, the organs will start going as well. Keep going. Hey, does anybody out there amongst this 47 people do neural therapy? I'm wide open.
I'm doing it.
Sure.
Hey, I hear Dr. Gerber. Are you in neural therapy?
About maybe, I don't know, since 1989, maybe.
Yeah.
Every day, miracles.
Oh my God. Thank you. So you know how simple this is and how powerful it is.
Absolutely.
Yeah. So we'll go, part of what we're going to do, the last 50 slides are on research. Unfortunately, my wife, who's an OB-GYN surgeon, and I had to do some research, so we did it. And I'm not going to go through the whole thing with you, but as Dr. Gerber can attest, the result of our research, I'll tell you what it is now. Out of 5,000 women, we had 39 that met the criteria. And the criteria was an abdominal surgical scar, either a C-section or a hysterectomy, vertical or horizontal. And the first and only treatment we gave to that patient was injections intradermally of that scar. And if it's a 20-inch scar, we try to do as much as we could. And the results were, so with only the treatment of the injection of the scar, most of the women came out, think of 53.4, 54.3, I can't remember. 53% of the women had noticeable permanent reduction of pain with only injections of the scar. So if you take a bunch of women and you shoot their scars, most of them, we got about 50-some%. I think it could be higher, much higher. Most of them said, I feel like a new person. I feel like I'm reborn. Right, Dr. Gerber?
Absolutely. And then doing a Frankenheuser on top of that down to their pelvis is even more impressive.
Okay. Well, Dr. Gerber's being humble. Not that many people go back to 89 with this, but that's when the Germans were trying their best, absolute best, to share their new discoveries with us. They were excited about it. And there wasn't much interest from the United States. I think we had 2 attendees in one of those years in Canada from the whole United States. There weren't many. How did you learn, Dr. Gerber?
I learned from Dr. Klinghardt in New Mexico, 1989. One of his nurses said, you got to come down and learn this injection technique. It's just magic.
Well, further in this slideshow, I have Klinghardt mentioned. The people who trained him are the same people I'm talking about. And it's a big concept. And then he went to Seattle. I think that's where he is now, maybe.
Yep.
Yeah, and he was dealing with some really interesting people because we're going to have to get into electromagnetics at some point. What the government has been doing with electromagnetic fields and what they've been not disclosing. So we have a lot of really important discoveries the government's been working with for 50 plus years. And The public doesn't know anything about this, but that's how long it's been. So it goes back with our government, absolutely, with mind control from electromagnetic fields back in the 90s, around 92. But there were other things that the government was closing. If we get into the alien thing, that occurred with a treaty in 1950s. I think it was 1954. So a lot of the new technology you see, the government will be releasing probably in a year. And that will deal with 0-point energy, reverse gravitational flight stuff. But anyway.
Dr. Burgess.
Yeah.
The the neural therapy the neurotherapy treatment was considered a pseudoscience in United States. I learned neurotherapy when I was a medical student. I went to Medellin, Colombia to learn it. And then when I went to residency training, internship and residency training, and then I went to Stanford, I was forbidden to talk about it. And when I came to Washington, D.C. from Stanford, I was forbidden to talk about acupuncture. So it was forbidden during those years to talk about it. And now I went to Wikipedia, and Wikipedia still considers it as both the theory and practice of neural therapy is a pseudoscience and offers and studies have found not to be of any benefit, but we know that it's magical. It works like nothing else I have seen in my life.
Yeah.
It is amazing, amazing. It has been suppressed for so many years, and now something has to be done now that JFK is at the health department, because it would benefit so many people, and mainly women after C-sections, and people with non-identifiable sources in the gums and the teeth. That something has to be done about it.
Well, that's very brave of you to speak, ZD. Very brave.
But that was history, was real history.
Well, I had to deal with that too. I had to get well or die. The Germans saved my life. And when I tried to share what they did and their Nobel Prizes and everything, I was told to keep my mouth shut, get out of the way. So a lot of the stuff we're dealing with right now, this new disclosure of information, is enough to get you killed. I want to be simple about that. I'm an old guy, but I've been on the run for 50 some years. So the kind of things you're talking about, be quiet and don't talk, that all becomes very real. But like I say, I keep my mouth shut about most things. And the government's probably going to disclose itself in the next year, a lot of these things. But what I'm talking about here is so much common sense. Dr. Gerber, this is about as easy and simple as it gets, right?
Absolutely. We just love to get rid of headaches in 30 seconds.
There you go. So we know how powerful it is, and we know how safe it is, and we're allowed to have brains. So, we'll talk about that. Anyway, systemic disease is when things screw up. Next, even with a 7-second delay. I'm glad you guys know about this. It's for a long time, there weren't many people talking about it. And if you combine that with acupuncture, Dr. Berger, the acupuncture, you look that up too, and it says it's a pseudoscience. There's nothing to it. And if we talk about the new Tesla energies that I have been witness to, that can be used for, stimulating acupuncture points and stuff, it's profound. So if they can't get along with neural therapy, manual medicine, the human touch, acupuncture, Then you can discuss segmental therapy and get into the details of that, and they might back off a little bit. But we are all, a lot of us here, we are clinicians. You know, it's not just talk. We're trying to keep patients alive, and that's what this is about. Next, Bill, next.
I have Werner van Braun on.
Werner von Braun. Where did all this stuff come from? All this neural therapy came from the Germans, came from the Nazis. They were experts in three different things: rocket technology and torture. So this group of guys here are the Operation Paperclip that the United States government brought to the United States after World War II to start a rocket program, and that's Werner von Braun, 1/3 of the way from the right, in the middle, tall, good-looking guy. And you can go to the next. But these were the specialists in torture and recovery from torture. In other words, how to inflict pain and how to reduce pain. And we got those guys. They came to the U.S. and set up. Next, they set up our torture research programs, child torture research programs, mind control programs, and that was called Operation Paperclip. That's just reality. And are we moving, Bill? So the German scientists set up MK Ultra, and if you guys don't know about that, that was the child torture conditioning That's Werner von Braun. He's the guy that took us to the moon. Next. And he gave us warnings, too, about what's going on right now. So before he died, when I talk about this disclosure of information, before he died, he was begging, please don't take war and conflict into space. That's what he was last words. Please watch out. And when it came to how they developed all this rockety, he said one thing: we had help. And you guys, that meant alien help. And then after that, within 10 years, they had the international treaty with aliens to be quiet about this. And that's all real. But anyway, Werner von Braun, he ran the slave labor camps to make the rockets, but then he came here. Project MK Ultra. This is all CIA. They did a lot of it. And they said they stopped doing it in 73, but it was still going on. But this was heavy stuff that started with child torture and everything in the 1950s. Program. Anyway, a lot of illegal activities, basically with LSD, hypnosis, sensory deprivation, verbal and sexual abuse, and torture. Next. So anyway, these are the guys who are the master. That's why I tried to lighten it up with the videos, man. This is heavy stuff. And when they brought the study to the United States, I was one who had my back broken in the process. So I had to learn what was going on. 44 different colleges and universities, thousands of children. This wasn't one or two. Thousands of children were being conditioned. And if you hold it on this slide just a second, this is what it's about. And they were turning these children into Manchurian candidates. They get them at 3, 4, 5. By the time they're 18, 20, they send them out to kill somebody. That's what it's about. And anyway, the CIA said and the government said, can we get control of an individual to the point he will do our bidding against his will? Even if he doesn't want to do it, will he do it? And even if it means he's going to die, even if it's against fundamental laws of nature as self-preservation. When you use these techniques in mind control that we'll go over here, you don't even care if you get killed in the process. You just do your duty. Next. But that was the idea. That goes back to 1952. So we're talking about, what, 70 years ago? This is old stuff. but it's all been covered up. You don't hear much about it. Are we still on slow, Bill?
Is that you?
Yeah. Can we slide it? Where does this delay come from? That's something brand new I've never seen before.
I don't know. I could come out and try, go back again, see if it stops it. Yeah, let's try that. So,
Oh, that's nice.
yeah, so let's try it again.
Oh, God.
All right. You got your screen now?
Yeah. Okay. Here's the question. Look at this kid. How does he look? How does he look? Go to the next slide. That's MK Ultra. Y'all remember this boy? Colorado theater shootings. Okay. This nice kid, straight A, good guy, everybody in the world loves. And then he gets MK Ultra, and what does he look like? Next. And you can see that there's next. Can you see a difference? This is like what we're saying, Dr. Gerber and Dr. Berger. We see people get well, but the public doesn't see it. Next.
I'm a few ahead of you there, John. I don't know.
Oh my, okay. I'll talk fast when we go through it. See what happens. Anyway, the things that could be used to mess a mind up or a body up or to torture somebody. The opposite techniques can be used to heal somebody. And our goal is to heal people. It's not to do this crazy stuff. I'm sorry about these slides. Anyway, this is what I went through. Next. They teach you in a secret program within this program. Top secret within this program was the torture program. So that's what all the pilots had to go through. But they had special things. Stop. This is where we need to stop. All you need to know is if you really want to mess up somebody's mind, get control, make them do what you want, you deal with isolation. Remember COVID? Just look at this. See if it reminds you of anything. Isolate. Anyway, you can have all those things that will mess you up, but then you can take neural therapy and put the people back together. And the one thing, the two things in that list of 7 items that you should remember, the number one thing that makes people go mad, if you have been witness to people who have gone insane, lack of sleep deprivation will put you through it. And that's where, so the number one thing that'll really make you crack, you can get control of somebody completely within 10 days. You can get 90% control in 3 days. Anyway, but the government's still doing it, Guantanamo. So what you're seeing there with that, what I was talking about, what I went through, SEER, that's what they use as a test to use in Guantanamo. And that's where they put the political prisoners and do a lot of stuff. Deals with water torture, or what's it called? Waterboarding, right? And they have another method that's like waterboarding where they stuff you in a box until your lungs fill with fluid and you suffocate, not by the water, but by your lungs filling up. You can't breathe. And you go through the worst pain you could possibly imagine because your joints start swelling and they tend to be tender. So anyway, next. Now you know why I got happy movies with this thing. So anyway, these are the experts in torture. We know what causes the pain and how to make it normal. And you guys have probably dealt with this, each of you. If you use lidocaine and cortisone, that's, neurologist, orthopedist. If you use lidocaine and sugar, you have the prolotherapist. This is crazy. But anyway, if you use lidocaine load, it's neural therapy. Prolotherapy, lidocaine, sugar. Orthopedics, lidocaine, and cortisone. And nobody ever thought in America, why don't we just leave out the cortisone and the sugar and see what happens? And that's what the Germans did for 50 years. Well, we are over here debating the issue. Anyway, we can get through the box. You know what it is. Anyway, all I was saying, if you've been, I went through about 10 years of rough stuff, and the Germans put me back together. They're the most incredible, wonderful people. They really have made discoveries, and they discovered 1990. This is 35 years ago. They got the Nobel Prize for realizing voltage is involved in the autonomic nervous system, and you can repair it with voltage. But who, other than Dr. Gerber, Dr. Berger, I don't know who learned. Anyway,
Dr. Bruce,
yeah.
For some reason in my notes, I tend to geek out and I'll be buying that book, by the way. But it says, I have in my notes, it says 4 neural clamps at a freezing point heals cells. I don't know where I got that from. Does that have anything to do with any of this?
I don't know.
Okay, we'll look into it later. Okay.
Yeah. But it's interesting you say that because I noticed some other people coming up with stuff I have never heard of before.
Okay, cool. And also the Germans did the fat stem cell.
Sorry?
Germans came up with the fat stem cell for inflammation.
Oh, they did?
Mm-hmm.
Yeah, it's fun. If you have a year off and you can go to Heidelberg, Austria, any of these places, just cruise. That's what I did for a year. I cruised doing that. And I went to the universities and medical meetings to try to find out what's what. Because if I didn't get some answers to what was going on, I wasn't going to live. I was in too much pain. And anyway, it's fun. And this group's fun because we're sharing a lot of information. Keep going.
It's so interesting for reflex sympathetic dystrophy or CRIPS. You know that you do a spinal block. And so it's interesting because it has to do with the light again. That makes total sense now. I never understood that until now.
Yeah. Well, at first it was too good to be true until I witnessed the most difficult pain patients be treated completely, thoroughly within a few days. Can we keep going, Bill?
Yep. I have Saved by the Neurotherapist. Next.
Anyway, so this is going to be a lousy film, but they can get the slides if they want. Anybody who's watching that wants to get the slides, they can get in touch with me or Bill.
Sorry, I'm on the segments now. Is that where you want me?
Nah, just keep going. So we have prolotherapy, orthopedics, and neurotherapy is just doing it without the stuff. And you're supposed to think segmental therapy. This is what the Germans do. Just keep going. And they divide the body into segments so you can do a spinal block. You can put needles wherever you want. But they want stop on this one. It's important though, if you can. Because the segmental therapy is what chiropractors study. It's what anybody who does manual medicine studies. And you can treat systemic disease. This is how you do it. You hit these different points. That's why I say get the book. You hit these points, they'll show you how to open the lungs, cure the gallbladder, do all kinds of stuff. And they make it so simple, but not many people are listening. Keep going then. But anyway, that one page we had here was totally dedicated to the segmental therapy. So if you guys want these slides, we'll have that listed. But if you get the book, you know, when it makes it this simple, somebody walks in, you want to try to settle the heart down, you hit this. Gallbladder, unbelievable, usually results within 5 minutes. Do you ever do gallbladder, Dr. Gerber?
Sure. A lot of lungs, a lot of IRRs. It'll get rid of an asthma attack immediately.
You know what? You know what? The Germans did not know one thing. They did not know what an IRR is. So what Dr. Gerber's talking about, infraspinatus under the shoulder, or it's a shoulder blade, respiratory reflex.
Infraspinatus respiratory reflex.
Right. And the Germans had never heard about that. Honecker had never heard about it. And we were at a conference in Florida. Somebody had an asthma attack. And this is after Dr. Honecker sent me out. He said, "Do you have any lidocaine needles?" I said, "Sure." He said, "Go get them." And I went to get them. And while I went to get them, one of the attendees had an asthma attack and was turning blue on the table. And I had just explained the IRR to Honecker 2 minutes before he sent me out the door. And when I came back, the mommy and daddy were over the 16-year-old child crying. I thought we killed her. And he said, "You're not going to believe it. You went out of here. She had an asthma attack. Drugs didn't work. She was turning blue. And we thought, what do we have to lose?" And they shot the infraspinatus, and she came right out of it.
Dr. Philibert in New Orleans was the IRR, one of the IRR creators.
Is he the guy who I didn't know who I know it works. I just didn't know who figured it out.
Dr. Philibert. Yeah, we just do Ashi points on the scapulas where it hurts, and just do intradermal blebs, and then down to on top of the scapula, north, south, east, west, on the outer part of the bone. And then do the front ones that you've had in your previous slides.
And almost always works, right?
Absolutely.
No, I mean, this is big stuff, but it's simple and cheap, so people aren't listening. All right, so they will show you different techniques. If you're doing sphenopalatine, you can do it this way. My wife likes to do it. I do it this way, and my wife goes through the palate, and that kind of drives me crazy. But everybody has their own way, and this is what they ask you to do. Do your own way, discover some things. Just understand what's happening. You're restoring voltage. Next. Yeah, and for people that have real pain, real headaches, you have to get a little deep sometimes. You have to do some things to save their life.
Yeah, that was Harry Philibert, by the way.
Thank you for that. Next. So anyway, there are different ways to get to different spots in the body. Understand you're trying to get a segment. So if you have a scar on a segment, other things within a segment, front, back, side, different ways. You find out what's your easiest way. The Germans never said we have the best. It's just their opinion that they were doing the best that they could. Keep going, Bill. What's happening here? I apologize to everybody that I couldn't get my...
I got Netter's Orthopedics up.
Say what?
My screen says Netter's Orthopedics.
I'm just telling the books to get. So how many books? How many books do you have by Netter, Dr. Gerber?
I don't. I have those earlier ones on segmental, and then the original English version of the 1980 versions of the Hunicke brothers, in their show of about 85 different places to shoot neural.
And we'll just talk because we've already been here for an hour. So books on orthopedics, pain management, Waldman. The government shut that organization down. It was the largest in the United States. Dr. Burgess, that organization in the United States with the Academy of Pain Management, and they were all shut up, told to be quiet. Anyway, you can get these books. What you feel. Hey, the secret to osteopathy, what you feel is real, and go with the flow. It's real simple. And there's Klinghardt. He has a different way of seeing things, does he not?
Yep.
Yeah, he does the autonomic reflex therapy, ART, right? And Dr. Kidd, we should mention him too. He brought it to Canada. And next. Anyway, we'll get to our research here in a bit. It's real simple. If you inject the scar in the belly, most women will have a major reduction in pain. And this, one of the criteria for our research was they could not have pain in the belly. They weren't complaining about pain in the belly. They're complaining in the back and the neck and the extremities. The scar was on the belly, but they had no pain there. That was one of our rules for the research. And still, most of the women had most of their pain majorly reduced permanently with only injections of the scars. And the reason for that too is we have a Ren channel, and they're the Germans. We have a Ren channel, major highway down the middle, Du channel in the back. So if you have surgery, lumbar surgery or C-section surgery, it'll be blocked. But you can open it up in what, a minute, 10 minutes. And the Germans will say, if you need to repeat it, 3, 4, 5 times, go ahead and do it. Because it can only repair to the extent of the damage. Somebody has been chopped in half, it's a different world. And crush injuries tend to be some of the worst injuries. Keep going, Bill. So again, I wanted you guys to know they discovered this in the 20s, the 30s. We're 100 years behind because if it's cheap, safe, and easy, and it works, not everybody's on your side. Anyway, what was I trying to say? Oh, lidocaine is an anti-arrhythmic, right? So if you have a dysrhythmia, which is creating the pain, everybody knows that lidocaine can be given to stop a heart dysrhythmia. Pain is another form of dysrhythmia. Lidocaine stabilizes it. If you have a radio and there you go. If you want to know some of the history of pain, here you go. Start way back. And this is what the Germans did. They went way back. And they were in the 1880s. They were exploring and discovering things. And by 1920s, 30s, they had figured out a lot. Keep going, Bill, because I think all we have here is this history, and we can chat if anybody wants to. And we can send you these slides if you want to. I gave you about maybe half the book, but I'm encouraging you to buy the book because it's worth it. You there, Bill?
Yep.
How come it doesn't change? This is weird.
I'm changing it. Transcutaneous anatomical specific homeopathy. No needles required. That's what's on my screen.
Yeah, well, we got teaching, theories, experiments, terms and definitions, man. We're back in 6000 BC. You're dealing with modern stuff. And by the way, yeah, so this is my teacher. That's Anton Jayasuriya. Okay, stop, Bill, if you can with this. The guy you saw there with the Pope was my teacher, Anton, and he was, and he saw about God. He wrote 120 books and he saw 3 million patients. So that's how he learned this. He developed. Stop switching, Bill. So okay. Were you going backwards?
I went back to my screen. Now has the Pope and your.
Okay. Oh, we're seeing it. We're seeing the trash page. 2 things are involved with transcutaneous anatomically specific homeopathy, right? And that is the formula, the homeopathic formula, the driver, whatever you want to put in it. And so that's the formula. And DMSO is the driver I usually use. But anyway, stop there on this stuff. I want people to know what. He's a guy who developed homeopathy and acupuncture. He was also the personal physician to Queen Elizabeth. He's a trip. Anyway, if you saw him see lines of hundreds of people and saw them all get well, you'd be blown away. Anyway, he developed homeopuncture. Other people can take credit for it if they want, but the man who really pushed this was Anton Jayasuriya. All right. Yeah, and he's okay, stop on this. You got 5 frequently used distal points in homeopuncture. All right, everybody see that? This, we will, man, it keeps changing. Anyway, I gave you a few slides of acupuncture points and the homeopathic remedy that is used to treat the problem. And we can't keep them up on screen, but that's okay. We are going to be presenting an entire book in 1 month in Reno on homeopuncture. And I don't think there's ever been a book written on it, and not many people know about it. But it's just common sense. You're using a driver to put a homeopathic. You choose the homeopathic in an acupuncture point or a healing point. It's very simple. You can put it on scars too. Do you ever use DMSO, Dr. Gerber?
Yes.
Yep.
So is that what, did any of you guys ever put homeopathics in the DMSO 50-50?
No, it's a good idea.
Yeah.
Possibly. Wink, wink.
Oh, yeah. Man, we got a bad connection here. Sorry about that. Anyway, points. If you guys want to know some of this, we can send it to you. But this is how you do it. You hit the acupuncture point with the homeopathic, and you get an increased stimulation of the point without having to use the needle, without having to use the syringe. You don't have to make them bleed. You don't have to worry about infection. But how many infections have you seen, Dr. Berger and Gerber, with acupuncture? I've never seen one. It's all connected. Embryonic development. That's what the segmental therapy is about. Excuse me. Segmental therapy. It's embryologic development. And the reason we can treat the brain and pain and neurologic disorders is because the skin and the nervous system both come from ectoderm. That's kind of the trick. It's kind of cool. And they want you to just know it's regulating therapy. We know what that is. Let's see.
John.
Yeah.
We're going to inject an acupuncture point, say LI4.
Yeah.
How much you're going to use lidocaine or procaine?
No, I don't. I don't inject acupuncture points with lidocaine.
All right, so you're going to use procaine.
No, I never use procaine. I saw more reactions with procaine in a week than I saw with lidocaine in 30 years.
So what are you using?
Lidocaine 1%.
Okay. How much lidocaine will you inject it into a point?
Total body, I like to keep it at 10 and lower. If somebody is strong and healthy and they need 20 cc's, they can usually survive 20 cc's.
That's for 1 point or for the
no, man. No, Manny. If I hit 1 point, I really don't do more than 5 cc's. So if we have somebody with L4, L5, bilateral compression, facet compression, you could put 5 cc's, 1% Lido at all 4 points, all 4 facets.
Mm-hmm.
But they're probably maybe a little dizzy or lightheaded, maybe. But nobody has passed out. But on procaine, man, that's why they developed lidocaine. Procaine was developed in 1905, but it has cardiac dysrhythmic qualities, whereas lidocaine, 1943, has cardiac stabilization qualities. So everybody in 1943 thought it was a miracle. dentists thought they were blessed by God in 43.
Okay.
But I can make a comment about that. The people I heard in the American Academy of Stem Cell Physicians said in a medical conference that lidocaine has a quality of numbing or impairing the function of stem cells, while the marcaine just induces the stem cells to work normally.
Yep. I don't use. I haven't heard that, and if it's true, it's great. I don't usually use the lidocaine with the stem cells, not mixed together.
But most people use the lidocaine because it's very hard to get the marcaine.
Because it's
Yeah,
cytotoxic, at least it is in our cases. When I've done it for adipose-derived stem cell or mesenchymal, it kills the cells. The studies we get back, or like when they process it and multiply it, we don't get as much live cell. That's awesome about the marking, though. I'll look into that. Thank you so much.
Well, do you use an anesthetic at all, Joni?
So we use local to aspirate, and then the vibration is our anesthetic, believe it or not, because when it's vibrating, the cannula, and you're in the right plane, it actually doesn't hurt.
Vibration is the best therapy to use because activates the cell membranes and reduces pain and makes everything the healing more natural.
It's funny and I'm sorry I have off video with my family, but in my office I have a vibration plate for every bed, and I give them I hand them not a vibrator but a facial vibration device to help distract the facial nerves. But yes, that's what the cannula is, vibration cannula.
Well, I learned two things tonight: marcaine and vibrations. And by the way, one of the slides we went through here, this just shows some of the stuff you can treat with the neural therapy. But the reason I think it's cool is because Bonica, and have any of you guys out there done pain management or any of that? The Bible of pain management is Bonica or Bonica. I don't know how you pronounce his name. He has a 2-volume set. So he said, so anybody in the United States who's trained in pain management and goes through Bonica will know what he said. He said in the mid-50s, we had the most advanced golden age of anesthetics, where we were able to have our highest success with the treatment of pain with lidocaine. Okay. He said it was diagnostic. If you hit it and the pain's gone, it's diagnostic, therapeutic, it helps the person get well, and it's prognostic. You can tell if it's going to take them a week to get well, 3 months to get well, and you can do that while you treat them once or twice. But it was the only treatment that was diagnostic, prognostic, and therapeutic. That's in the 50s. That's what we had. That's the highest success rate we have or had at that time. And that was a statement made 50 years after the 50s. So, okay. Marcaine, huh? That's a trick?
I was taught that procaine enters the cell and stimulates the ATP to heal itself and acts as a mild numbing agent, very short-acting numbing agent, whereas lidocaine numbs the area and has to go to the liver to be broken down.
Yep. And as far as the toxicity, I talked to the people, the German neural therapists who have done billions of injections, and they did not see the toxicity. and I did not see the toxicity. So I think, but there are a lot of people who are given the, the idea that they have to use Procaine because it's safer than lidocaine. But if you're actually a clinician who does it, and you see 100 times more reactions with the Procaine, I just don't buy it. But I need to learn more. But we never saw the problem. And everybody in Germany told me the same thing. They never saw the problem.
All right, where are we, John?
I think we're just about, well, just if you can flip through the research, let everybody look through the research themselves. I just put that there, 50 pages of geekdom for those who like to do research. And in the first 1-2 pages, I tell you what's going on. We inject the scar and their pain goes away. It's as simple as that. But in Germany, they do have rules. Rules. Pain has to go away for 24 hours or 20 hours. And anyway, the other thing they use in pain is narcotics, right? I'm from the heroin capital of the United States, Martinsburg, West Virginia. And I just made a joke there that we use narcotics like duct tape. Whatever your problem is, we can make you better with narcotics. So we moved a lot of, we're heroin capital of the whole country, man. So there wasn't much encouragement to get rid of the drugs. And if you tried to get rid of the drugs in our county, you weren't treated too nicely. Anyway, all these guys, including people in this group, have saved my life, so I appreciate it. That's good. Any questions, anything, we can do it. But the research, look at it on your own. Just know we did it, it worked, and it's kind of simple. And I think the idea is no hurdle is too big, so we'll figure it out. That's it. Now we get into research. John Milam was a researcher and my wife. And it just says if you inject the scar, pain in other places go away with a 54% success rate, which proved a point for those who say, Dr. Berger, what? It's, what do they say it is? Unproven or what?
Experimental.
No, Dr. Ziti, what were you saying they called it earlier?
What? What?
The neural therapy. They were saying it doesn't work.
Pseudoscience.
Pseudoscience. Thank you.
Yeah. It is written, if you look it up in the Wikipedia, it says it is a pseudoscience.
Yeah. Yeah, I stopped believing what they wrote a long time ago.
I think the Wikipedia was reviewed about 5 years ago, and they got rid of all holistic and alternative therapies.
Yeah.
Like discredit everything.
How do
Everything, all the herbs, all the natural remedies, all the homeopathy is a pseudoscience. So everything that is natural, that saves the body, keeps the stem cells alive and growing, is a pseudoscience.
That's why this group is alive. We're supposed to change that.
So, John, what does a treatment session look like?
For me?
Yeah.
Usually I spend an hour or two with the patient initially, just finding out what's going on. And then if I use 3 things, I use stretch, massage, inject. And I can do the acupuncture too. So first of all, I tell the patient to decompress and stretch, give them the exercises, and that takes care of it. And massage machine you can get for about $50 now. It does an incredible job off Amazon. And if that still doesn't work, the decompression, the massage doesn't work, medicine doesn't work, then I'll do the injections. And what I've been doing for the last couple of years is use homeopathy and acupuncture, what we call homeopuncture. I mix it and I put that in the acupuncture point. And that's just a drop, a micro drop on an acupuncture point. And if their pain goes down significantly, I don't inject. I don't need to, because homeopuncture is powerful. And then if they need to, I will inject shallow, maybe 2 inches, inch and a half, at wherever they hurt, especially the scar. And a rule with German neural therapists, you must inject the scars. If they have surgical scars, you have to do it. And you're required to do that first. So usually I will inject the scar to see if the pain goes away. Half the time it does. Most of the time it does. And then if it doesn't, I do the normal American joint injections and, spinal injections. And except with me, I didn't want to use these CT scan, so I used a $70,000 ultrasound machine my wife had sitting here for babies and pregnant women. So I had the joy of using ultrasound for a long, long time. Yeah. And that's a simple way of getting in. And that way you can watch where the fluid goes too. It's not a still picture, it's fluid.
All right. So I come into you, I have a partially torn rotator cuff on my left shoulder. Let's get to the neural therapy, since that's the topic tonight. What are you going to do?
You inject all the way along. The prolotherapist would say, shoot more in the tendon, right? At the enthesis, where the muscle and the tendon join, or something like that. But anyway, you can inject right into it. You can inject, throughout the muscle that's torn or partially torn. And usually I just see good results with that. So and if not, they go on.
How long would a session, how long will it last? You repeat it in a week, in 2 days?
Yeah, I would do it in a week. I might see them 3-4 times.
The lidocaine will last, a couple of hours, right?
That's wrong. That's where that's what we got to get clear here. When you inject with the lidocaine, is it a block or an opening? You can get the temporary numbness for maybe a half an hour, but the opening effect, the increased communication within the segment and within the nerve, go to 3 to 5 days. So the effect is 3 to 5 days. That's why we wait a week. But we have this mindset. It's what do you call it when you cognitive dissonance? Well, we've been saying, it only numbs up for a half an hour. Only numbs up for a half an hour. The numbing has nothing to do with it, folks. Not a single thing.
So, Dr. Burgess, can lidocaine be used like subdermically in an acupuncture point to create this opening for pain?
Yeah, and in the books it gives specific instructions on that. But you would. It's really nice to be able to do all the fancy needlework. But a lot of this now, you can hit that acupuncture point you're talking about, where that area you want to hit, with transdermal homeopathy. So you don't have to inject and think about popping their eye when you do it.
And the transdermal homeopathy is done with homeopathic drops of the kind that you put under the tongue, or the kind that you inject?
You could do either way. We could extract from the oral stuff, but you may be familiar with Traumeel. If you do surgery injections,
Traumeel's is an arnica combination.
Yeah, it's got 14. Yes, it is. It has arnica in it and about 13 other things. It's a combination. You can find out what's in it if you want.
Is this the Traumeel that you find at the natural markets?
No, I only use injectable. I use the highest end.
I don't think you can get it in the U.S. anymore. I used to use it all the time.
I know.
Can't get it anymore.
I know that they blocked me from Germany, Italy, Russia, and now maybe Greece. So I'm talking with other manufacturers and other smart guys to see if they can manufacture it.
Right.
So all we used forever was Turamil, which had 14 homeopathics in it, and it was sealed in glass.
How do you spell that? Tromil?
Traumeel. It was the good stuff that almost all of us used. But then the government blocked it. I called the FDA and said, how come you blocked this? And they said, the German factory was too dirty. You guys buy that?
No.
So anyway, it's
Yeah.
Dr. Burgess, I have a quick question here. Since
Yeah.
you're not using the lidocaine as an anesthetic at all, can you add bicarb so that it's less, they get that less of a burning sensation?
you could, but I've never had a problem with the burning sensation, pain, or technique.
Okay.
Yeah, because you can always slow down, right?
Yeah. But when you inject the big C-section scars, even though the women have quite a bit of numbness there, it burns like crazy if you're not using some bicarb.
No, we've never had a problem.
Okay.
Yeah.
And again, you can do it slow. Just do it slow.
I'll chime in. I mix it with a little bicarb. So
Thank you.
Yeah, it seems to take the sting out. So yeah, in acupuncture school, they taught us to inject the scars. They called it unblocking. So and they used lidocaine or procaine. So I'm assuming it's the same thing. So,
We just use vibration.
True. Thank you.
So for the past 15 years or so, I've been using the acupuncture points for pretty much all of my injections. So I do, like Dr. Collins, I do a lot of cosmetic injections in the face, and I use the acupuncture points there. It seems to, if you know where those points are, it seems to create much better coverage so I can use a lot less product to cover the same area as recommended by the manufacturers. Mainly things like Botox or even in the lower face fillers. We seem to be getting the big stem cell exosome practice here in Reno closed recently, and so we're seeing a lot of those people. And I'll use the acupuncture points to inject shoulders and knees, and they seem to work quite nicely. So if you know where those are, I find it quite a bit of a help. As far as ultrasound's concerned, I have a little handheld device that was about $2,000. You plug it into your iPad or iPhone, you use that as the screen. And I've had ultrasound technicians look at it, and I'm still learning, but it seems to do the job. I can give you the name of it when we're off the CME.
Is that butterfly or another one?
Well, I'm not mentioning names because we're CME clock. So
I'll be quiet.
Yeah.
Yeah,
So,
they work wonderful, and I paid 70,000. You can buy what you have for
Yeah,
2,000, and it works just as well.
I paid $3, but that's with lifetime updates. So,
It works great.
yeah. So and they work very well. I'm still learning how to use it, but I'm getting better at it. So and you can watch like John said, you can watch the needle, go into the joint, where you're at. We got pretty good at it even without ultrasound, I think, over the years. So that's kind of my experience with it. As far as like facial work, I never say never, but I almost never get even a drop of blood anywhere, just maybe superficial when we inject the face and the acupuncture points. I have, since I've done that, I've not had one complication with eye droop or anything like that. That's your main issues with when you're doing neuro modulation. And I've not had any issues with getting needles into getting products into blood vessels with the fillers too. So the acupuncture points, whoever came up with those, in my mind, was were, you know, how they did it, I don't know, but they came up with I think, you know, to me it was the answer, because I was having trouble at one point. So that's my 2 cents on that.
I'll give you another 2 cents because I forgot to say it, but there's one absolute rule. Everything you can't be lazy with this. If you're going to do it, Germans always aspirate every time before you put in procaine, lidocaine, whatever the mixture is. Aspirate first. Make sure you're not in a vessel.
Obviously, yes.
And that's pretty important with the upper cervical. You have to aspirate or you could be risking their life. You can put them into a seizure for 20 minutes or knock them out, but if you aspirate, you don't have that problem.
Okay. Dr. Nario has some questions online.
Yeah, so John, that was a great discussion. So I mean, some thoughts here, as I do neurotherapy as well. And I actually have seen this because, as we know, when you do neurotherapy, it's actually unlocking your autonomic nervous system. And emotional responses actually are some things that I've seen, that emotional release also can happen.
Yeah.
And,
yeah, you
definitely
get
right.
those who say they feel reborn.
Right. So don't be surprised for you guys out there doing it, that this can definitely happen. So we're not only talking about physical pain, John. So even nasal and emotional dumping can happen with this. And not only are we going to focus on scars, there are also other things that we can inject. For example, like tonsils that were removed, dental problems that they're working on. So dental injections can also be done with neural therapy. And the one thing that also was mentioned here that I think was a comment rather than a question was procaine was noted to be more stimulatory to the autonomic nervous system versus lidocaine. So I think I've been hearing you discussing with the audience about lidocaine versus procaine. So both, I guess, just depends on what your objective.
Right. You can have stimulus. You can have stimulation or normalization. The way I do it, I like the word normal.
Right.
And that's why the lidocaine works well. It doesn't overstimulate and create reactions.
All right. So one of the questions here is, in your case, other than pain, what other situations or conditions that you use procaine with? Neurotherapy with?
Yeah, either I'm just a pain guy, but I've been around the block a few times. But function, structure function. Try to normalize the structure so they can walk, so they can paint, so they can drive, so they can have a family. And function.
Okay. Yeah, I think that's basic, really. I mean, this is really known for pain relief. But there's so many. I mean, even a very stressed individual can actually benefit from neural therapy, just to make sure that they go into this sympathetic phase rather than being in sympathetic. So I have seen practitioners use this also as a starter in relation to detoxification. So it can definitely loosen up everything even before any IV therapy, any acupuncture therapy that you do. It's just a good startup to give you that good foundation.
Well, with our work with the United Nations in Sri Lanka, before they would do acupuncture, as was mentioned, they do neural therapy first. So if there are major scars, they don't want to waste their time. So they believe neural therapy is quite often necessary before you even start the acupuncture.
Right. Here's a good practical question. If a practitioner wants to start doing neural therapy, let's say tomorrow or next week, what's your safest and most effective entry point, and what are your suggestions on how they can start with this?
And how you deal with the spinal stuff?
No, I mean just starting the whole practice of doing neural therapy. Would you want them to go through a class, read your books, or?
No, you can read the books, which is always nice, right? You're reviewing that for the rest of your life. Mm-hmm. But all of you guys are trained come on, unlimited license in surgery and medicine. That's most of the people we're talking to tonight. So you've had all the training you really need to not kill somebody, but you have to be a little bit safe, like with the aspirate, and not overdose. So, you don't want to give too much. But once you get the concept that this block is not a block, but an opening, then it all starts to make sense. You're not blocking it, you're opening it. And that's where we all go wrong, because we think, okay, you get a half an hour of lidocaine numbness and that's the end of it. That's not. It's a 5-day process.
All right. You mentioned Tromil here. Somebody's asking if you use pure Tromil or you add something more to Tromil. You mentioned about DMSO a while ago.
Wow. Yeah, I one nice way of doing it, if you have real Tromil, which we can't get anymore, which is a crying shame, was to mix the injectable Tromil 50/50 with the DMSO. And that's a nice, simple way of doing it. But I've done it with things other than that. I've taken oral formulas, extracted the homeopathic energy from it, added that to the solution. But, and that's been mind blowing. It really has, because very small amounts of oral homeopathics, the pellets, whatever you call those things, little granules. You're supposed to take what, 10, 20 at a dose and do that every 3 hours. I was able to take like 4 to 5 of those small pellets and extract the energy with the DMSO and the Tromil homeopathic, and I think it had an added effect. I wasn't expecting it, but I'm amazed how you can take a small amount of product and then soak it, solve it, however you're doing it, and then use it. And it's very efficient. You're using about 1/10, maybe 1/100th as much of product.
Right. So I don't want to make you kind of drool about this, but when I go to the Philippines and I see patients there, I have this convenience of getting Tromil, and I inject it using neural therapy methods. So that's why our practitioners here on the call who are from the Philippines, you guys are very lucky to have that over there. Use it wisely, use it as much as you can. And I know the distributor of Tromil over there, so they're just so blessed with this gift that there's no authorities running after them about this.
Wonderful. Tromil, for the cost, if you actually produce this stuff, you succuss and make it yourself, you can work really, really, really hard, or you could pay a reasonable amount with Heal and Tromil and have a perfect solution that has already been researched. So we don't have to do the research. But that's a blessing.
Right. Well, John, thank you so much. That was an awesome talk. Amazing.
Thank you.
Okay. Okay, John, thanks a lot for everything. And we'll see you all next week.